My ADD symptoms were almost within probably 6 months of my periods coming back, completely gone,
Mm.
completely gone. When you're looking at ADD, ADHD, autism spectrum, and sensory processing, a lot of people don't realize that there are a lot of people with dual diagnoses, triple diagnoses. And currently, when you look at the DSM, you're either this lane, or this lane. When the reality of the matter is, many people have multiple of those issues combined. And we see that all the time. And so today, I'm actually really excited to talk about whether you have the diagnoses or you don't have the diagnoses. You're not going to want to miss it today. I'm going to give you the next lesson, the next holy grail, which is hormones is freaking matter so much for our kids and for each of you, especially when you think about the timing of when these symptoms really started to get worse.
Mhm.
Think about it. Look at your own timeline. Think about your own kid's timeline. I always talk about this hormonal timeline that we all have, and that's giving you clues. For example, young teenage or right around puberty, their symptoms can sometimes get a lot worse. So you adding new symptoms or new diagnoses. And then you're finding adult population that are being diagnosed will be, let's say, women. Postpartum will be a time. Will also perimenopausal between the age of anywhere 34 to 54, right around those 2 decades. It's women are getting diagnosed with that all the time. And men, what you will find is, yes, there's that teenage period of time, early teenage year, right around puberty, when there's a hormonal surge that can cause that to happen. But men experience a rapid decline in their hormones somewhere around their mid 30s and also to their mid 50s. So you'll see men with a new diagnosis or worsening symptoms around that time. But yet, the training that we give conventional doctors and even naturopaths and functional medicines around these hormone patterns and hormone shifts is very little. And I would love to ask both of you guys, what did you guys learn about your hormones that you felt was critical, and what were the changes that you noticed? Jody, go for it.
Well, newsflash. I have hormones of an 85-year-old woman. Who knew?
That's not
I'm only
normal. You're not supposed to be
53.
upset. Oh, it's normal. Not normal.
Yeah.
Totally not normal. Again, but I didn't know this. And so that in itself was eye-opening. I was like, my God, I'm 53, not 85. What the heck? So it's so like I'm at a loss for words as far as how this is all intertwined and connected, and it just all makes sense. Knowing that now I have to, do some things, add some supplements in to figure it. Now I had breast cancer, so there's certain things I can and can't do with that. So it's a work in progress, but again, data, actual factual data.
And think about that. The reason behind breast cancer too is that for many people it's a hormonally related cancer. So these hormone imbalances is not only feeding these symptoms, but they're also feeding cancer that are hormonally sensitive. That's another reason to be, dealing with hormones. And looking at my own history, here you go, everybody. I wasn't diagnosed with ADD until I was 38. Never been diagnosed with ADD before. But at 38, I was diagnosed with ADD. And that was the time when I had the hormones of an 85-year-old. And when they told me I had early menopause, 36 to 38, that whole period of time. And the interesting thing is, by me actually learning how to understand how to test my hormones, how to understand the patterns that we have, and also its link with some of these symptoms, I was able to, quote unquote, it was like it's a miracle. Maggie came out of menopause, which I did at the age of, I think about 39. I came out of menopause, regular periods again, and my ADD symptoms. I mean, I took medication for another 2 years because I thought I was supposed to, right? And honestly, I thought that was only a solution. But my ADD symptoms were almost within probably 6 months of my periods coming back, completely gone,
Mm.
completely gone.
Wow.
So, how many people are having these diagnoses or worsening of it because of a hormonal imbalance that their doctors know nothing about? Remember, I'm just going to list some hormone patterns here. I'm just going to do it. Okay. Everybody pay attention. Write down some notes right now. Another truth bomb. Okay. When you have patterns related to estrogen dominance, PCOS, low everything, when you have these hormone patterns, the symptoms with ADD, ADHD, autism spectrum, sensory processing disorder goes freaking berserk. And yet, none of the doctors that you've ever spoken to or worked with knows what the hell I just said.
They don't. They really don't. And I can speak from experience because I was trying for years to get help with my hormones, and I never could. No one ever could crack the case until I joined the Transform program, truly. And it was like, I cried. I cried to finally understand what was going on with my hormones my entire life. And things dramatically turned around almost immediately implementing your suggestions. And on that note as well, you know, for adults who are dealing with hormonal imbalances and issues, it absolutely, I can tell certain times of my cycle that I have focus problems, that I have brain fog issues,
Yep.
and it happens like clockwork.
Nailed it. Yes, right there. And
Yep.
that's the level of awareness we need to have for ourselves. Like, and you shared this on your vlog when you went through the program, but what happened with your periods?
Regular for the first time in my life.
Within the first month of being in the program.
Yes. And it's been regular every month since I've been graduated from the program. So that is something that I could not achieve. I couldn't achieve. And I tried. I felt like I tried it all, you know, researched it all, talked to every doctor I could find. And it wasn't until I finally found Dr. Maggie. And that was the whole reason that I sought you out, was it all fell into place.
Well, I think what it is because I think from my own experience with having my hormones completely gone when I was, 36, early menopause, diagnosed by laboratory testing and symptoms. And then the turnaround and all my education around this over the last, 27 years in practice, the last 16 years was about learning about this. I feel like I feel actually really blessed that I'm able to take all that knowledge, experience, personal experience and training and put it into teaching you guys how to do that, because there's nobody, I feel like the level of training that doctors have gotten, none around this, even functional and naturopaths, that doesn't mean they're an expert on hormone balancing. I feel like it's critical to teach you guys how to do that. Right. For any of you guys out there that are watching this, if you know somebody, please help me raise awareness. If you can tag somebody that you know in the comment section, that'd be really great. And then if you have any questions, we have additional trainings and resources that we're happy to share with you, but we can't share it with you. We don't know that that's what you need. So if you comment in the comment section, that'd be super helpful. We're also going to drop a link with which you can chat our team. So our team will drop a link right now in chat, and also on top in the copy of this video, there's a link to chat